The American Cancer Society estimates that about 1 in 23 men and 1 in 25 women will develop bowel cancer during their lifetime. Bowel cancer, also known as colorectal cancer, is a type of cancer that originates in the cells lining the colon or rectum, which make up the lower part of the digestive system. It typically starts as small, benign clumps of cells called polyps that form on the inside of the colon or rectum. Over time, some of these polyps may become cancerous. In today's video, we will delve deeper into 10 symptoms of bowel cancer that may help you detect this disease at early and protect your life. One thing to keep in mind is that before making significant alterations to your diet, you should always consult a registered dietitian. But before we start, let's first understand how bowel cancer progresses. Bowel cancer progresses through several stages, which help determine the extent of the disease and guide treatment options. 1. Stage 0 carcinoma in situ. This is the earliest form, where abnormal cells are present in the inner lining of the colon or rectum and are not considered invasive cancer yet. 2. Stage 1. Cancer has grown into the superficial layer of the colon or rectum wall, with surgical removal often being curative. 3. Stage 2. The cancer has grown more deeply into or through the wall of the colon or rectum. Treatment typically involves surgery. 4. Stage 3. Cancer has spread to one or more nearby lymph nodes. You need to have surgery to remove the cancer and affected lymph nodes, followed by chemotherapy. 5. Stage 4. This is the most advanced stage, where cancer has spread to distant organs such as the liver, lungs, or even the peritoneum, the lining of the abdominal cavity. Treatment may involve surgery, chemotherapy, radiation therapy, targeted therapy, or a combination to manage symptoms and prolong life. Now, let's find out the symptoms of bowel cancer. 1. Persistent change in bowel habits. Changes in bowel habits may occur at any stage of bowel cancer, but they are more likely to be noticed as the tumor grows and becomes more obstructive, which means the first 2 stages of the disease. These changes may manifest as constipation, diarrhea, or an alteration in the caliber or size of the stool. A meta-analysis of 14 case control studies showed a statistically significant 48% increase in the risk of colorectal cancer in association with constipation or infrequent bowel movements. The bowel's function is closely tied to the balance of fluids and the smooth operation of the intestinal muscles. A tumor may disrupt this balance and the normal rhythm of bowel movements. For instance, if the tumor causes a partial obstruction in the colon, it might lead to constipation. Conversely, if the tumor irritates the bowel's lining or causes inflammation, it could lead to an increase in the secretion of fluid into the bowel, resulting in diarrhea. One food particularly beneficial for managing bowel habit changes is soluble fiber, found in foods like oats. Soluble fiber may help to normalize bowel movements by absorbing water and adding bulk to the stool. This may alleviate both constipation by softening the stool and diarrhea by solidifying it. 2. Jaundice. Jaundice, characterized by the yellowing of the skin and eyes, occurs when there's an accumulation of bilirubin in the blood. The liver processes bilirubin, a yellow pigment that results from the normal breakdown of red blood cells. When bowel cancer spreads to the liver, which happens at the last stage of cancer progression, the liver's ability to handle waste products, including bilirubin, may be significantly impaired. The liver, overwhelmed or damaged by the cancerous cells, fails to process and eliminate bilirubin effectively, leading to its buildup in the body and resulting in jaundice. In a study of 62 patients with metastatic colorectal cancer who developed jaundice, the most common cause was found to be intrahepatic biliary obstruction, particularly in younger patients. As the liver becomes more involved, patients might also experience other symptoms related to liver impairment, such as fatigue, itching and dark urine, all signs of the body's struggle to manage and excrete bilirubin and other toxins. Since liver health is at stake here, one food that stands out is garlic. Garlic is renowned for its detoxifying effects. It helps to activate liver enzymes that assist in breaking down toxins. Additionally, garlic's high levels of allicin and selenium have been shown to protect the liver from damage and support its function. 3. Abdominal pain, discomfort, or bloating. For men over 70, the risk of intra-abdominal cancers like colorectal cancer is 3%, significantly higher than expected. People with bowel cancer often experience abdominal pain, discomfort, or bloating due to the physical presence and growth of a tumor within the intestines. These symptoms may occur at stages 1 and 2 as the tumor grows larger, causing more significant obstruction or irritation in the bowel. It may impede the passage of food and waste, leading to discomfort, pain, and bloating. The tumor might also cause inflammation in and around the bowel, contributing to discomfort and a feeling of fullness or bloating. Additionally, as the cancer progresses, it may lead to a buildup of gas or changes in the gut microbiota, further exacerbating feelings of bloating and abdominal discomfort. To mitigate the discomfort associated with these symptoms, dietary modifications may play a crucial role. One particularly beneficial food is ginger. Known for its anti-inflammatory and gastrointestinal soothing properties, ginger may help alleviate symptoms of bloating and discomfort. 4. Unexplained weight loss. This symptom may emerge at stage 3 of the disease. The presence of a tumor within the bowel may physically obstruct the passage of food, hindering the normal digestive process. Moreover, cancer cells require a significant amount of energy to grow and proliferate, diverting nutrients away from the body's normal functions and contributing to weight loss. Additionally, the presence of cancer may trigger systemic inflammation, further altering metabolism and leading to muscle wasting, a condition known as cachexia, which is characterized by a significant loss of body weight, muscle atrophy, fatigue, and weakness. However, people should remember that, according to a study, short-term weight gain of around 5 kilograms in the previous 2 to 4 years was linked to a 14% higher risk. To counteract this risk and support the body's nutritional needs, incorporating foods high in protein and calories is crucial. One such food is avocado. Avocados are nutrient-dense, offering a rich source of monounsaturated fats, which provide a healthy boost in calories and energy without the adverse effects associated with saturated fats. 5. Fatigue and weakness. Cancer-related fatigue is a common symptom in patients with colorectal cancer. Approximately 30% of patients experience persistent or chronic fatigue. Patients at stage 3 in their battle with cancer mostly experience fatigue and weakness. One primary reason is the cancer's direct effect on the body's energy resources. Cancer cells compete aggressively for nutrients, depriving healthy cells of the energy they need to function properly and draining the body's energy reserves. Additionally, the body's immune response to cancer may contribute to fatigue. The effort of the body to fight the cancer, repair damaged tissue, and maintain normal functions amidst the onslaught of cancer cells may exhaust energy levels. To help mitigate this risk and support energy levels, focusing on nutrition is key. One food that is particularly beneficial for combating fatigue is spinach. Spinach is rich in iron, an essential component of hemoglobin, which transports oxygen in the blood. An adequate supply of oxygen is crucial for energy production and may help alleviate fatigue. 6. Anemia. Absolute iron deficiency anemia is the most common type of anemia in bowel cancer patients, representing about 80% of cases. People should remember that anemia becomes a prominent symptom as the disease progresses. The development of anemia in bowel cancer patients may be attributed to several factors directly and indirectly related to the disease. Firstly, the cancer may cause chronic bleeding within the gastrointestinal tract, especially if tumors are located in areas prone to damage or if they become ulcerated. This blood loss, even if small and continuous, may deplete the body's iron reserves necessary for producing hemoglobin, the oxygen-carrying component of red blood cells. Additionally, bowel cancer may hinder the absorption of crucial nutrients like iron, vitamin B12, and folate due to the tumor's impact on the bowel's lining or because of treatment-related bowel damage or removal. These nutrients are crucial for the production of red blood cells, and their deficiency may lead to anemia. To help mitigate the risk of anemia, a diet rich in iron is essential. Lentils are not only an excellent source of iron, which is vital for replenishing the body's hemoglobin stores, but they also provide protein, fiber, and other minerals and vitamins that support overall health and well-being. 7. Rectal bleeding. The bleeding may vary in severity, from slight traces of blood that are noticeable on toilet paper to more significant bleeding that is visible in the toilet bowl. The color of the blood may also provide clues about the location of the tumor. Bright red blood usually indicates a tumor located in the lower bowel or rectum, while darker blood may suggest a tumor higher up in the colon. Several studies in patients presenting with rectal bleeding have shown a change in bowel habit to be significantly associated with a diagnosis of colorectal cancer. In the course of stages 1 and 2 of bowel cancer, as the tumor grows, it demands a larger blood supply, leading to the development of new blood vessels, a process known as angiogenesis. These newly formed vessels are often more fragile and prone to bleeding. Incorporating foods that are gentle on the digestive system and support vascular health is crucial. One such food is beets. Beets are rich in dietary nitrates, which the body converts into nitric oxide, a compound that helps to relax and dilate blood vessels, improving blood flow and reducing the pressure on the fragile vessels in the bowel. 8. Increased gas or indigestion. The process of digestion involves a complex interaction between mechanical movement, enzymes, and bacteria in the gut. A tumor may alter this delicate balance by obstructing the bowel's lumen, slowing down the passage of food, which in turn provides more time for fermentation by gut bacteria, resulting in increased gas production. During the development stages of the tumor, indigestion is highly noticeable in the patients. A study involving 45,828 individuals with newly diagnosed gastroesophageal reflux disease supports the hypothesis that it is associated with a significantly increased risk of colorectal cancer. Probiotics may help restore the balance of gut flora, reducing the fermentation that causes gas and improving the overall digestion process. One such food is yogurt. 9. Unexplained fever. One large-scale Caucasian population-based study showed that fever of unknown origin is often associated with colorectal cancer. As the cancer grows and potentially invades other tissues or causes complications like blockages or infections within the bowel, these issues may further provoke fever. For example, a tumor causing a partial obstruction in the bowel may lead to an accumulation of bacteria and potentially an infection, which in turn may trigger a fever. Additionally, cancer treatments such as chemotherapy may weaken the immune system, making the body more susceptible to infections that may cause fever. To help mitigate the risk of fevers and support the body's immune system, maintaining good nutritional status is crucial. One food that is especially beneficial is garlic. Garlic has long been recognized for its immune-boosting properties, largely due to its compounds like allicin, which have been shown to enhance the functioning of the immune system. 10. Blurry vision. One potential link between blurry vision and bowel cancer could involve nutritional deficiencies. Bowel cancer may impact the body's ability to absorb nutrients such as vitamin A. Vitamin A is crucial for maintaining the health of the retina, and a deficiency may lead to vision problems, including night blindness and an increased risk of eye infections, which might present as blurry vision. Moreover, cancer-associated retinopathy is a condition where the immune system, due to cancer elsewhere in the body, mistakenly attacks proteins in the eye's retinal cells, leading to vision problems. This happens because the body creates antibodies to fight the cancer, but these antibodies also attack similar proteins in the eye. Considering the potential link between nutritional deficiencies and blurry vision, carrots emerge as an excellent food to help mitigate this risk. Carrots are rich in beta-carotene, a compound the body converts into vitamin A, which is essential for good vision. Who is at the most risk of developing bowel cancer? The risk of developing bowel cancer increases due to several factors, making some individuals more susceptible than others. 1. Age. Age is a primary risk factor. The majority of cases occur in people over the age of 50. However, it may occur at any age. 2. Genetic factor. individuals with a family history of bowel cancer or specific genetic conditions such as Lynch syndrome or familial adenomatous polyposis are at a higher risk. 3. Lifestyle choices. Diets high in red and processed meats, low in fiber, fruits and vegetables, physical inactivity, obesity, smoking, and heavy alcohol consumption have all been linked to an increased risk of this type of cancer. 4. Medical conditions. People with a history of inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, have a high risk of developing bowel cancer. If you experience any of these symptoms, it's important to consult with a healthcare professional. Early detection and diagnosis of bowel cancer may significantly improve outcomes, despite the fact that they may also be due to other, less serious conditions. Hence, always consult your healthcare provider if any of the earlier mentioned symptoms persist longer than usual. Remember, being informed and proactive about your health is key. Today, we learned about all the symptoms that you may experience at different stages of bowel cancer. Similarly, you may also find out when your heart might be at risk. Want to find out more? Watch 10 warning symptoms of a stroke 1 month before it happens. Or watch 12 early warning signs of heart disease your body is telling you about. You may watch either or both of them. Do you know any other symptoms of bowel cancer that were not mentioned earlier? Let us know in the comment section below.